I mean, I work out pretty much out of 7, probably 5. Different types of exercise, I try and vary it. Resistance training, cardiovascular, like an exercise bike. I used to do weights, I still do some. I quite like swimming, although I don't go swimming as much as I used to.
Now, exercise can help in managing acute pain by improving joints and muscles back to their sort of pre-bleed or pre-injury status, getting them back to moving the way they should move and getting them as strong as they were beforehand to prevent further bleeding and further damage. And secondly, sort of exercise can help patients with chronic pain by once again increasing sort of strength in joints and muscles and increasing or maintaining ranges of movement, which allows people to do daily activities far more easily.
I think exercise is quite important. My orthopaedic surgeon told me when I had my knees replaced that if I didn't use them, I'd lose them.
The training is the nuts and bolts of sort of what an athlete does, and I consider for myself that the training is the nuts and bolts of keeping me together. So I just sort of get on and do it.
I always try to do a lot of walking. I do hydrotherapy twice a week. I try and do exercises in between at home. So yes, I do think exercise is quite important. It's not always possible to do it when you've got a bleed, and you shouldn't beat yourself up about doing it when you've got a bleed. But
people with haemophilia will always have good days and they'll have bad days, and we all know that sort of on those bad days their pain will be worse than at other times, but on the good days their pain will be less, and it's those days they sort of need to target to try and do an activity or introduce an exercise into their lifestyle. And by gradually increasing that, they shouldn't increase the amount of pain that they're suffering. If they find they're suffering increased pain as a result of participating in an exercise or activity, they're probably doing too much.
One of the best exercises that I've been able to do is to swim twice a week, and doing that has been great. You know, I can swim 20 lengths, and my muscles feel much freer.
I did a sponsor walk recently for Crusade, which was 6 miles. And I'd never actually done the Crusade walk before. It raises money for HIV. Now last year, I was involved with it, with the support group I'm involved with, but I couldn't do the walk because my joint was not good enough, my ankle joint. This year, I did the walk, and I had to give myself 1 lot of treatment before, take anti-inflammatories, and 1 lot of treatment after. Okay, but I did 6 miles in 2 hours, and it rained as well. But I did it, and if I, that type of thinking, last year I didn't. This year I did.
The only way I could cope with it was not to give up, and to try and do as many things as I possibly can. Sport, as leading as normal life as possible, having a good social life, going out to the pub, taking a pretty girl out to lunch. All these things, are important things in my life.
my attitude has always been that if you want to do something, you'll do it, and you're not going to let very much get in the way of doing it.
If there's some kid out there now, or anybody that's in a down period and they're saying all this has got on top of me, I mean, I've got this far, and I was there 15 years before drug therapy, and I'm still alive, okay? I might not have much of an immune system, I might be on drug therapy, and I'm not perfect, but I'm still there, and I've still got ambitions, and I've still got drive, and, you shouldn't let that go, ever.
Being able to keep going, I think is important in that it pushes the pain into the background. If you're at home, if you're sitting around at home, just sitting on the sofa watching the TV, the pain can start to take over. Whereas if you keep going, if you try to keep going for your everyday life and the things that are important to you, the pain gets shoved into the background and becomes just a secondary thing that's there nagging at you in the background. It's not something that's important.